My name is Dr. Rodney Haring. I am the chair for the new Department of Indigenous Cancer Health at Roswell Park Comprehensive Cancer Center. Previously, we were a center within Roswell Park, initially the Center for Indigenous Cancer Research, and as time went on, we also incorporated the Center for Indigenous Cancer Services. Focus areas would be health research, cancer health research specifically, and co-occurring conditions that happen in our communities, but also in the area of how do we translate the research into practice into our communities through service and outreach and education. The Department of Indigenous Cancer Health at Roswell Park Comprehensive Cancer Center is the first of its kind at any NCI designated cancer center in the country, which is monumental in many different ways. One, being the first, but also working with other cancer centers and universities across the country, Indian Health Services, and other institutions that collaborate in the space of health and wellness of our communities. What we do now is important, but how we build a framework out for future generations is really the crux of where we want to be in creating and developing the center. Many Indigenous nations have a philosophy of looking forward many generations. For the Haudenosaunee or the Iroquois or the Iroquois nations, we have a principle same and similar. We call it the seventh generation philosophy. It really provides a foundation for the health and well-being of our societies. And it's something that was given to us by our ancestors, and now it's our responsibility to move that forward, building out employment opportunities, career opportunities that incorporate that we provide space in our department for that kind of thinking. We also have been working with other institutions across the country and across the world and sharing how our department came to fruition, the efforts of our center over the years, and the successes of our staff, not only in the research context, but also in outreach and service and through areas such as patient navigation that really bridges into our communities. When we start working in the context of bringing health, education, research to our communities, it's in the context of a government to cancer center relationship. So that's what separates us and puts us aside in a way that our conversations are often of that nature of working not only in our regional context, but to recognize the sovereignty of Native nations and territories and reserves and First Nations in Canada as well. And our sovereignty and our self-determination, and what brings us to the table is often that conversation over treaty rights, responsibilities of health, and how we put that into action through nation governments and conversations. As time goes on, we're going to be hiring more staff, more faculty members, and across different disciplines as well. I think that's really important about the work that we do. It isn't just health research, but it's also in the area of service. It's also in the area of education. It's also in the area such as environmental health and the relationships to cancer. And it's also in the area of physician scientists. So as we continue to grow as a department, our goal is to combine or braid all these disciplines together in a forward-thinking, seven-generation philosophy to work together across departments at Roswell Park, amongst our colleagues nationally and internationally, to put together a framework for the best possible outlook moving forward and having that forward thinking for our future generations. The transparency of how we do that is also very important. So in 5 years or 10 years or 15 years, it's a cycle of growth. It's a cycle of development. It's a cycle of laying down a foundation to put forward the best we can collectively within our team, within the departments across Roswell Park, and across the country and across the world.